Good afternoon. And I am so honored. I am Lori Hall. I am from Eli Lilly and Company out of Indianapolis, Indiana. And I'm so humbled to be here among all of you. You are the rock stars of health literacy in my mind, the people that I've read about and watched online and saw your research, and to now be sharing a room with you is humbling and highly rewarding. So I just want to remember this moment. Anyway, I'm here to tell you about another journey, a journey of health literacy at Lilly. And my journey, the journey you'll hear from me, is a little different. It's the journey of how one person with not an advanced degree and not in a management or director or high-level C-suite position could actually make a difference at a large Fortune 500 company. And that was it. There we go. It's to be in Washington, D.C. and not feel history all around us. I thought I'd share a little bit of history about our company. You may wonder, what is Eli Lilly? What is that? It's a large global pharmaceutical company headquartered in Indianapolis. We have offices in Puerto Rico and 17 other countries with a growing portfolio of products sold in approximately 125 countries. It was founded back in 1876 by Colonel Eli Lilly, who was a pharmaceutical chemist and a veteran of the Civil War, after whom the company was named. You may know Lilly from our diabetes portfolio. That's sort of where we got our start, and we were the first to bring commercial insulin to the market, and we still have a very strong diabetes presence and is something that will continue to be near and dear to our hearts. Overall, Lilly's mission is to provide answers that matter through medicines and information for some of the world's most urgent medical needs. The department I come from is important to understand because that's where health literacy was born in our organization. And the name of our department is called Health Education. And I am one of the consultants there. I'm one of four, actually. And the vision of our team is to provide foundational knowledge and skills to engage, educate, and empower patients to be active in the management of their own health care. So that's the thread that runs through everything that we create on our team. Our mission is to create and deliver non-branded, non-promotional patient education materials aligned with health literacy principles in the areas where Lilly has presence and expertise. So I want to stress that this is the area of the company that has nothing to do with our products and everything to do with patients and education. In fact, there's a firewall between what our group does and what our marketing teams do. So who we are, the Health Education Department is a customer-facing team of healthcare providers or healthcare professionals focused on delivering customer experiences for patients. In addition to the consultants that are inside the organization in Indianapolis, we have a field team of 10 health education professionals who have advanced practice nursing and pharmaceutical experience, and they call on our health plans, our payer customers, of which United and Humana and Aetna, some of the smaller regional plans, as well as the larger health plans as well. We don't talk to them about our medicine. We talk to them about patient resources that we try to understand what their unmet patient-related needs are and try to match those with the portfolio of patient education resources that we have available. So what have we done at Lilly around health literacy? This is a very new initiative for us. You've heard some other speakers talk about spending a great deal of several years, and we're really still in our infancy. Only a couple of years have we been engaged in health literacy, but we're making strides. Here's where we're at this point. So far, we are conducting health literacy pilots in the areas of clinical trial management and informed consents. We're doing a pilot in the medical call center, medical education grants, and brand marketing. And again, each of these lines with our principles of engaging, educating, and empowering patients to be more active. So those patient touch points within the organization become very important. So that's inside Lilly. So if you start to kind of go outside of Lilly in our Indianapolis community and state, we've done some health literacy presentations during employee wellness series. We've done something called Lilly Neighbor Nights because although we're a large corporation, we're a neighbor to a large residential area, and we want to be a good neighbor. So once a year, we allow the community to come inside the walls of Lilly and understand what we do. Presenting health literacy was one of the most recent events we've done. We've also partnered with Indie Reads, and it's an adult literacy program. We've done presentations at the Marion County Public Health Department, and Reach Out and Read Indiana is another group that we've actually done presentations with. This is something we're really proud of. This is just this year. Supported by educational grants from Lilly, we have supported a number of regional medical education programs. These are the ones that we funded for 2013. The Pri-Med South and Pri-Med Houston have already taken place. The turnout was amazing. The intent here was to educate primary care physicians in the areas of health literacy. You'll see a number of topics that are coming up: primary care network, virtual rounds, Pri-Med West, and so forth. And on a national level, just recently we won the published materials category for the IHA Health Literacy Awards, and that's something we've been very proud of. It's not so much about winning an award, but when you have an opportunity to show even your internal colleagues that health literacy is real, it's important, and it's not just something that is the passion of a few people, that it's something that is recognized externally, and it's something we ought to be caring about. So to which of the 10 attributes do our efforts relate? At this point, I can confidently tell you that attribute number 8 is where we sit now in terms of designing, developing, and implementing patient-ed resources that meet health literacy principles. We are working to have mastery in other attributes as well, but we're just not there yet. We're still early in the process, but that's something I work on all the time. So what generated the interest at Lilly to begin with? Back in 2009, this is something that predates me. It was the efforts of a colleague in the consumer marketing area that actually started to hear a little bit about health literacy, but didn't really have a good understanding of how much our organization knew about it. So she commissioned Health Research for Action. Many of you may know Linda Newhouser and Becca Rothschild. They are out of the School of Public Health at UC Berkeley, and they did an assessment. It's a very small assessment. They interviewed 20 key staff from Lilly and selected agencies that we work with to learn about the training experience they had, were they aware of policies and standards and challenges and any recommendations. So it started with this sort of little mini assessment. And the key findings were both interesting and concerning. The interesting parts were most of the key informants felt that it really was important. Health literacy was something we should be involved in and certainly should understand better in terms of how it has the effect on patient outcomes. They felt like in some respects it would help us comply with FDA regulations and guidance. But here are the challenges. And you'll see the number one challenge identified by our key informants were that we simply just did not have adequate knowledge and expertise. We had a limited pool of affordable agencies who have health literacy expertise. We outsource. We don't have on staff agencies who help us create our materials. So identifying agencies who have that expertise was certainly a challenge. We didn't have sufficient standards and protocols, so there was a lot of inconsistency. Time constraints, certainly. You're hearing a lot of themes now, I'm sure. Lack of trust and communication among departments. For our organization, we have to meet FDA requirements, and oftentimes what we're trying to do with health literacy and what the FDA requires us to do are in conflict. So that conflict is a great source of concern at some points. Certainly resistance to change, and for some of our marketing teams, it's this perceived constraint on creativity. So it started with that awareness that we've got work to do. So we knew instinctively, this is when I came on board, and I just heard a mini presentation on the outcome of that report. And I knew we needed to do something. We had to do something that we'd never done before. And I am not an outspoken person. I am an introvert in every way, shape, or form. I'm not someone who typically leads the parade on anything. But for whatever reason, this spoke to me. And I decided to make a difference. I knew that any efforts around creating a health literate organization had to certainly support the business plan. It had to be perceived as not some sort of pet project or some flavor of the month, something that would be here today, gone tomorrow. I knew that instinctively. I knew it had to build in efforts that were already in motion so that this was not a separate work stream, that this was something that had to be integrated into the work that everyone's already doing. This just becomes the how we're doing what we're already doing. We needed to use evidence-based tools and resources, multidisciplinary approach, certainly support from senior leadership, but most importantly, awareness, awareness, awareness. So I created a team from the ground up, and I don't know if other groups have tried this before. I had a sense that if this was going to work, we had to get the ground force engaged. So I created a grassroots initiative of advocates from many of the major consumer patient touch points within Lilly. So we've had representation from certainly our consumer marketing teams, but from informed consents, we've had from the call center, we've had from professional relations and advocacy, we've had global patient safety representation. So, but none of us have any advanced credentials around health literacy, and none of us have any management experience. We're just a front line of people who care passionately about patients. We call ourselves Health Literacy Matters. This is, again, an attempt to kind of weave back into the company vernacular of Lilly Answers That Matter and Health Literacy Matters. So it was a way to weave those concepts together. We started with coming together as a team of about 12, and we energized ourselves around deciding to do some things around Health Literacy Month. So we have a collaboration site with facts, tips, tools, and resources. We received training from Berkeley. We did a number of awareness presentations throughout the organization, too many to count. We had a multimedia internal communication plan, so we were on television screens and the little tickers at the bottom and little internal newsletter reminders and little articles of interest and so forth. And then we kind of culminated the week with, in October, once a week in October, we had a different thought leader come in. And this was through an effort, honestly, through blindly emailing the health literacy rock stars that I've been talking about, a number of, probably many of you in the room, saying, I know you don't know me, but I come from Eli Lilly and Company, and I think that we could really benefit from your expertise. And I just sent email after email. And luckily, these 4 people were kind enough to come and speak with us. Toni Cordell certainly was a wonderful way to start things off with her personal journey. Michael Wolf, Michael Posh-Orlow, Linda Newhauser. So it got some interest internally, and we got momentum. How did we get things going? So we started with a really small health literacy pilot with just a couple of pieces. We decided to not even they're not branded pieces. They are not even around a disease state. They're around just the normal building blocks of health literacy, healthy eating, and being active and we took our existing pieces, tested them, rewrote them, and the pilot has really served us quite well. We did the revisions to follow health literacy principles. We actually conducted usability tests with real adult literacy patients or consumers. And then we did pre and post SAM assessments. The real test, though, is our customers, and our customers are health plans. Oftentimes, some of the requirements that we've had from our customers in the past have been very practical requirements. For example, we've had the requirement that it must fit into a number 10 envelope, above and beyond everything else. We broke all of those rules, but when we could share with them that we've had wonderful success, superior range with the post-SAM assessments, it is now our number one most heavily utilized resources. And as a result of that, we have gone to a fully committed all patient-facing materials approach that our team is dedicated to. So anything coming out of our organization does that three-step process moving forward. So we are now serving as role models for the rest of the organization, where you can see where we have some additional pilots going on. I can't believe I'm out of time. Barriers have certainly been the traditional things: lack of awareness, but even some internal things that were kind of disappointing. One gentleman who I was quite surprised at, someone talked about some of the failures, was he said, I just can't believe health literacy is a problem. He said, why do I feel like it's some sort of manufactured crisis for us to all run and solve? And it just tore me up. So I'm thinking about him today. So an FDA requirements certainly become a challenge. Moving forward, we've got a pilot going on now that will do a more holistic approach of training key stakeholders, legal, medical, and regulatory, and taking on an entire marketing team and trying to engage them and serve for them to serve as role models to other marketing teams. What we'll continue to do is share the successes we've had under our belt. I will be prepared for the failures, and we've got a number of health literacy champs within the organization that could not make this possible if we didn't have them. But one of the sort of things that we're going to keep the conversation alive around is just the topics on health literacy, and we do not have a dedicated health literacy department, director, a group that is wholly in charge of that. I do this as a side to what my day job is. So any thoughts on how I can sort of lead the charge on that, I'd greatly appreciate it. But one thing I'll just leave with is that I'm finding this journey around creating a health literate organization to be a 2 steps forward, 1 step back process. But I'm choosing to not let that get me down, and that success is for those who simply don't give up. So thank you.